Hi everybody, my name is Desirae. I'm a physical therapist assistant at Superior Physical Therapy. Today I'm just going to talk about 5 simple stretches that you can do for your back. This is a good video for techs and learning how to take patients through some stretches the correct way. So let's get started. So the first one is going to be your hamstring stretch. So what you're going to do is take this strap here. You're going to wrap it around the bottom of their foot. And with this one, you just want to make sure they're keeping this knee here straight. And then this opposite leg is going to be straight down as well. A lot of people will try to keep their knee up, but it gives you a better stretch if you lay that flat. And then you just have them relax their head and use their arm to kind of pull up till they feel a good stretch along the back of their hamstring here. On this one, we typically want to hold for 30 seconds and do it twice on both sides. So I'll hold it, and it's been 30 seconds or so. I'm going to switch it over, same thing, make sure they straighten this opposite leg out and keep this knee straight. Sometimes they'll tell you they'll feel it more in their calf than in their hamstring. So if they tell you that, you can allow them to bend their knee just a little bit, and then it'll target their hamstring just a little bit more. And on the flow sheet, you'll see that one is just a hamstring stretch. So the next one is just a single knee to chest, and on their flow sheet it usually just says SKC. That just stands for single knee to chest. So on that one, same thing, you want their opposite leg straight, and then the one they're stretching is just going to go like this. Hold for 30 seconds again, and usually do it twice on both sides. With stretches, you usually want a total time of a minute. So if they can't tolerate holding it for 30 seconds, have them do 5 sets of 10 seconds or 4 sets of 15, anything like that. But usually we just use the 2 sets of 30 seconds. Okay, and then the next one is called piriformis. There's a couple different ways to do this one. One of the easier ways is to bend one leg up. You cross this one over so that your ankle is on your knee here. And then this one I usually have older folks do, or people who are in a lot of pain, where they just will pull it across to their opposite shoulder. And I usually tell them you should feel that right in your mid glute there. And most people will be like, oh yeah, yep, that's where I feel it. And the same thing, hold for 30 seconds. And then they'll switch and do it on the other side. The other way to do this is instead of just pulling across, you put it there like this, and then you grab under your thigh of the opposite side and pull it up. This one's a little more difficult, especially if you're older or if you're in a lot of pain or not as flexible. This one will give you a little better stretch. So just a couple of variations on that. That's the piriformis. The next one is the double knee rotation. That one you'll see on the flow sheet as DKR most of the time. It won't really spell it out. But on that one, it's really simple. Just nice and relaxed on the upper body, and then you're just going to let your knees fall to one side like that. You would want to try to minimize your hip raising up on this opposite side. So you want to try to keep your hips down and just let those knees fall. Same thing, and hold for 30 seconds or so. And then you'll switch it over to the other side. Okay, so then the last one is the hip flexor. This one can be a little tricky. A lot of people will say it increases their back pain, so you just have to kind of cue them on some muscles to contract. So what you do is you have them slide all the way out to the edge of the table as far as they feel comfortable, and then have them hang their leg over the edge. So you're going to have them hang their leg over the edge, and then their opposite leg is going to be bent, because that's going to kind of protect their low back a little bit. But even then, sometimes they still will say, it kind of hurts. If they tell you that, what you want to do is cue them to contract their ab muscles here, their lower abdominals, and try to pull their pelvis up towards them in the front. And what that does is kind of eliminate that curve in their low back. So if they tell you that it's hurting there, just have them cue that. If it still hurts, maybe just grab the therapist or something We can kind of modify it a different way. But this is a good one, and you always want to cue them to relax their hip, because a lot of people will be like, oh, okay, yeah, I'm stretching, but you know that they're just holding that up. You want to have them completely relax that here and feel the stretch right through that hip flexor in the front. And make sure they have this other leg bent up. A lot of people will be like this, and that's worse on their low back. So I always have them bend that opposite leg up. And those are 5 good stretches for the back.